would you support extending some of these subsidies that are expiring? And in addition to that, how should Republicans go about tackling Obamacare when some of these things are up for expiration, and whether you guys are going to reform them or not?
I mean, close to home, I've been a physician, ran a practice, surgical practice, so I know what Obamacare looks like on the other side. You know, the promise to keep your doctor, that was an absolute lie. What these subsidies did is they basically were big boondoggles for insurance companies. They're the ones who got most of the money. And where you have subsidies going to people that are making several $100,000 a year, that is a waste of the taxpayer money. So if that's where we're starting from, a lot of those things need to be pulled back. I'm happy to look at some of these things, but again, it's just, which I guess the Democratic Party loves to do, is a boondoggle for insurance companies. We need to look at this judiciously, but a lot of them need to be rolled back completely.
Well, this is a debate we need to have. We want to make sure that folks who are participating in the system have an opportunity to buy insurance. I'm not a big fan of Obamacare. I don't think anyone on the Republican side is. But we want to understand how it impacts the lower middle class. The last thing we want to do is have people fall back into Medicaid, which means we're subsidizing the entire group. I think that's one of the main issues we're going to be confronting in the fall, and try to right-size something so that folks who are working hard can get that insurance, because if you fall back on the taxpayer, you're going to have even more budget pressure.
I think it's time to start letting them expire. I think it's a case by case, but yeah, we have a lot of problems. The problem we really have, though, is Republicans run against Obamacare, but they need a substitute for that, and that's where we're going to have to really get to work, I think, and something has to take its place, and it doesn't need to be more government involvement. I would submit to you more capitalist ideas and quit allowing the pharmaceuticals to dump everything on America, us having to foot the bill, pay exorbitant prices where other countries don't.
Well, we need less government in our life, and so anything that Obama had that expires is good for America.
These programs that a lot of people rely on, Medicaid is something that a lot of people in my district rely on. Our goal is to make sure that those programs are viable, they're sustainable, and they're there on into the future. And so making some of these decisions may seem heartless, may seem cruel, but they're not. They're actually, we're trying to do the best thing we can so that those people, those low-income people, those people with disabilities, the people that truly need these programs, that those programs are in place for them into the future.
I think it's time to let them expire. I got elected in 2014, took office in 2015 as a doctor, on the platform of eliminating Obamacare. I have 5 children and 17 grandchildren, and I got tired of hearing my kids and my daughters and sons-in-law come up and complain about what they were paying for their health care insurance. It was to pay for Obamacare. The deductibles are far too high. The premiums are like paying another house note each month. And yet the deductibles are so high they can't use it unless something, God forbid, a catastrophic health problem, a car wreck, or God forbid, or something like that. Basically it's only a catastrophic insurance policy.